Good afternoon, ladies and gentlemen. We welcome you to our new masterclass series in collaboration with the Ministry of Health, the College of Physicians Malaysia, and the Malaysia Advanced Acute Internal Medicine and Ultrasound Society, MIMUS. Your microphone will be muted throughout the event. You can use the chat function to ask questions during the masterclass lecture, and the speaker will answer at the end of the talk. Please join me in welcoming Dr. Omar Sulaiman, the Head of National Transplant Resource Centre, NTRC Malaysia, and also the Head of Department and Senior Consultant Anaesthesiology, Department of Anaesthesia and Intensive Care, Hospital Sultanah Aminah Johor, who will now deliver our first masterclass lecture entitled Organ and Tissue Donation, a Gift of Life. Over to you, Dr. Omar.
Yeah. Assalamualaikum and very good morning to all of you. Thank you for the new man that inviting me to give a talk on organ donation in Malaysia. It's a gift of life. When we talk about organ and tissue donation in Malaysia, you all always comes into the media social that talking about something showing what is going on in Malaysia when we're talking about organ and tissue donations. So some of them mentioned about this lady. If some of you realize that, if you remember this girl, she's the one Malaysian and staying in Batu Pahat, actually is our the heart receiver. And then looking at the numbers that more than 10 or more than 21,000 currently that Malaysians on the organ waiting list. And even there, they mentions about facts of more than 100,000 people, including women, men, and all children are waiting list for an organ entire of the world. And we do realize that every 10 minutes, someone is added to the organ waiting list. And this photo shows that a baby who's suffering from something that respiratory or lung and end-stage lung problems, and also this boy who are suffering from end-stage kidney failure that require organ transplant to continue his life. So again, there's a lot of articles mentioned, even the photos mentioned, showing that in the UK's we really desperate need for organ donors because there's a long waiting list who are suffering from end-stage organ failure. And as I mentioned earlier, that every 10 minutes in the world that there will be one people who are waiting or in under the list of organ waiting list. And looking at this, basically, when looking at the numbers of patients who are suffering from end-stage organ failure, the numbers is increasing every year. Looking in Malaysia, when you look at this photo, there are these three ladies on the waiting list who are suffering from end-stage lung failure. Unfortunately, two of them passed away because they can't wait. There's no lung for them. And looking at the number here, the statistic from our Malaysian Ministry of Health showing that only around 1% of our Malaysian population, or about around 300,000 people, pledge for to donate their organs. And as I mentioned, there will be more than 21,000 of people in Malaysia who are the waiting list for transplant, and most of them are the kidney failures. To remind us again, in Stars Online, 4th September 2015, since we are very shortage of organs that to be transplanted and very limited numbers donors and very long waiting list, the most who are patients that are suffering from end-stage organ failure try to go overseas, mainly to China and India, to get the organ and also to get the donor. Then it costs almost 500,000 to go there. Then again, just remind, in Malaysia, it's only 1% of our population, around 300,000 of people only pledge for to donate their organs. Then mind you, more than 21,000 in Malaysia that waiting for the organs to be transplanted. While waiting for that, some of them, they just pass away. They can't wait for the new organs to be transplanted. So this again to show you. And if you're looking at this photo, these two ladies, okay, who are with their mechanical heart here, okay, waiting for their heart, waiting for the new heart. Basically, this lady received the heart from the donor, and unfortunately, This lady, while waiting for the heart, she getting worse, and unfortunately, she died because of end-stage heart failure. So, as my slogan, without the donor, there is no story, no hope, no transplant. But when there is an organ, life springs from death, sorrow turns to hope, and a terrible loss becomes a gift. That's what we mean by a gift of life. In Malaysia, what happened in 2010, from 2000 to 2010, the statistic from the National Registry of Kidney, they shows that every year there will become new patients that require dialysis and suffering from end-stage renal failure. And in our setting, there are 14 to 15 new patients on dialysis each day. But looking at that number of new transplant, it's very minute. It's almost static throughout for the past 10 years. So why I'm talking about organ donations? Yes, organ donation is the best treatment, or organ transplantation, basically what I can tell you, is the best treatment currently for end-stage organ failure. So by doing that, by doing the organ donation and organ transplantations, we're talking about dialysis equipment. Those who are receive an organ, basically when I'm talking about kidney failure, when they receive the new kidney, he can function or she can function normally without any dialysis. So for whatever dialysis that we have, the equipment there, though can be used for the new patients. And if you look at the entire cost, basically, when you're talking about end-stage kidney failure, when they require dialysis throughout their life, up to the last breath of their life, is very costly when we're talking about the long term. And as a person, I'm always talking about recycles our organs. 3R concept: reduce, reuse, and recycle ourselves. From this photo can tells you one donor actually can save up to 8 lives through organ donation and can heal up to almost 50 through their tissue donations. So you think when looking at these numbers, the role of organ and tissue transplantation actually can give a new life to suffering from end-stage organ failure. So whatever that I'm seeing is supported by all evidence base. From this article, it totally tells us that solid organ transplantations actually save lives in patients affected by terminal organ failures and improve the life quality of life. So basically, when we discuss and we talk about organ and tissue donation and transplantation, actually, from terminal organ failure, patients can fully recover, can improve their quality of life. And at the same time, what we always say that they can become like a normal people, they can become more productive when they receive the new organ. So what happened in the entire of the world when we're talking about organ donations rate? So by WHO, Global Organ Disease, Organ Donation and Transplantation 2019 mentioned that as we know that Spain always the highest number of organ donor. They have almost 35 donor per million population, followed by America that 25.5 per million population. Where are we actually? When we are comparing with our neighbor, Singapore, they have donation rates of 5 donor per million population. How about Malaysia? We are among the lowest, that probably I can tell you roughly 0.7 per donor per million population. We're looking at the graph mentions here showing that when we are comparing, when talking about organ and tissue donations, we have two types, either the deceased donors or living donors. Where are we? We are actually almost at the bottom here that I mentioned earlier, that our donation rate roughly around 0.7 donors per million population when we compare in Indonesia. But even though Indonesia is a bit higher when compared to us, they have mainly, but talking about their living donation, they don't have currently but deceased donation. So this article tell us that Malaysia is among the lowest donor when you compare to the whole entire 74 countries in the world. So when this is tell you the entire world about our rate in terms of not only Malaysia, the whole entire world, the targets from WHO, they tell us basically when you're looking at here, As the years go, almost every year, the number of patients suffering from end-stage organ failure increasing. Up to 2020, actually, we almost double up the number. More than 250,000 of patients are waiting list for organ donors and transplantation, this number, and you can see that the whole entire world, basically, the number of organ transplant or donor is almost at that level, static and plateau. So what happened in Malaysia actually? Our youngest donor in Malaysia at the days of 21st, when the patients donated the cornea and the tissues, and looking at the oldest donor that we have in Malaysia is around 82 years old people. So when talking about organ and tissue donations, there basically there's no age limit. So what happened in Malaysia when I'm talking about organ donor and organ and tissue donation rates in Malaysia from 2001 up to almost 2020, that last year, our donation rate basically can tell you is roughly 0.6 to 0.8 donor per million population. The highest donor that we have in 2015, where we have 71 donors, basically all the entire world. Basically what I'm telling you is that this is donor, and subsequently the numbers start coming down. So is it enough when we're talking about organ donation, when our number of patients suffering from end-stage organ failure is increasing? If you're looking at the rate here, from 2010, it's almost plateau, it's static, it's fluctuating with a small number. And I mentioned that 2015, our highest donor, around 71 donors, and subsequently from 2016, 2018, and 2020, the numbers start coming down and the plateau there. So is it enough to cover the whole entire Malaysian who are suffering from end-stage organ failure? These are the waiting lists in up to February 2019. Last year and this year, we have our pandemic of COVID. So the activity of organ donation and organ transplantation will slow down. And you can see that from till February 2019, what happened with our waiting list? Yeah, Chile is still the highest. It's almost 22,000 who are waiting list. The reason behind it, these people actually still can survive because the presence of dialysis to continue their life. What happened to the other organs? When talking about liver, heart, lungs, and those who are suffering or waiting for both heart and lungs, the number actually minute because they can't stay longer. The longer they wait, and the longer they wait, actually, they cannot survive. That's why you can see here the liver, heart, lungs, and heart, lungs. As it goes, the most they can survive up to the 6 months. Beyond that, they can't stay longer, then they have to end up with their life with the death. So, but kini again, we have still the big number there because dialysis still play a role. So up to February 2019, actually, the total number of waiting lists in our national NTRC around 21,630 patients. So with that, when we compare looking at our organ supply versus the demand, for the cadaver for 2019, only 28 donors, whereas the waiting list around 21,600 patients waiting for the organ. So this is the one that we're looking at the number, we're promoting the public, we let the public knows actually our waiting list is so much more, and as the years go, the number going to pick up. So what we have done, but before that, basically, probably I will tell you just briefly, when we're talking about organ and tissue donation, where are our resources? For the organ and tissue, basically, when I'm talking about, we can get either from the living donor, when the related or non-related patients who can then donate one of their kidney and part of the liver. Whereas when talking about the dead patient, whether it's a brain death patient or is a cardiac death. So the donors for the organ mainly from this time, except only for the cardiac death, what we are practicing in Malaysia is we only go for tissues donation. So brain death. When talking about brain death, basically our main resources, we're talking about the major organ, for example, the heart, lungs, liver and the kidneys is from brain death, that death declared based upon our neurological assessment when the heartbeat is still intact. When we're talking about another one, the donation, the DCD is donations after cardiac death, or what we talk about donation after circulatory death is non-heart beating donor when when the patients are asystole, and then we can procure their organ for transplantation. But we are not practicing DCD in our local setting because we need to go through entire law and legislation when we're talking about donations after cardiac deaths. Against the living donor, we are looking at the related and part of it unrelated donor, where is directed on non-directed relationships. So what happened when we're talking about organ and tissue donation? Again, in the stars, Friday, 12 April 2019, people are talking what happened with our organ donations in Malaysia. Why do we have only a few organ donors? Is it because we are worried that our bodies will be treated dishonorably, or it is because we are not sure how our religion views this matter? People are giving inputs. They are commenting why we have so few organ donors in Malaysia. So a lot of surveys were done. So one of it was low organ donation rate in Malaysia. So what actually happened? So they are looking in terms of almost 1,300 respondents to investigate what are the factors contribute in terms of the low number of organ donation in Malaysia. And surprisingly, actually, when we're looking, we always blame the religious or the cultural factors, but basically from that research, that survey mentioned that probably they're talking about lack of information. So not only that, looking what happened in 2013 when they do a survey, the organization in Muslim countries, the case of Malaysia. So even though we know that, looking at the number that I'm showing you after this, basically Malay Muslims are reluctant to become a donor. This is the one they make a conclusion. So what happened in 2010, they're looking at in terms of multi-racial Malaysian society. So when we're talking about organ donations and organ tissue transplantation in Malaysia, the low organ donation rate in Malaysia basically is multifactorial. We're not only confined to any promoter or any information, that a lot of other things, a lot of the co-founders that tells you basically why our donation rates, when talking about organ donation in Malaysia, is actually is quite low. So just want to mind you, when you talk about organ and tissue donation in Malaysia, basically under the Human Tissue Act 1974 is an opt-out in type of law, and it allows removal of organs from cadavers for therapeutic purposes. So the compliance with the law entails consultation with the deceased family and consent of the deceased family. This was under Human Tissues Act 1974. Still, we apply it up to today. So when looking about the religious, we always blame, basically people are blaming the Malaysian, talking about Islam is not allowed that. So under Islamic Ring Fatwa covering organ transplantation. So at the conclusion first, our Persidangan Jawatan Kuasa Fatwa bagi Hal Ehwal Agama Islam Malaysia in 1970 states that the transplantation, because during that time, we just confined to the eye transplant or eye donation and heart transplant and heart donation from a dead person to a live human being is permitted in Islam. Based on this, it must be urgent, important such the life of the recipient is dependent on the organ which can be successfully transplanted, that we are quite successful. And in case of the heart transplant, the donor should be confirmed date before the heart is removed. And all the at the last, the important part, basically, there must be no murder of human being and transaction of organs took place. So basically, our fatwa, Islamic ruling for covering the organ transplantation, Islam mentions that it can be donated based on these three factors. So it's happened that this is one of the meeting that I attended talking about the fatwa, Islam regarding organ and tissue donation. We do have this booklet talking about organ and tissue transplantation donation in Malaysia. So all entire world mentioned. For example, our Dr. Yusuf, basically when talking about organ and tissue donation, the laws basically tell you they allowed with the hukum of Harus. So not only confined to Muslim, what happened the other religious? When we're looking at the entire, the Chinese, we're talking about the Buddhism, we're talking about the Hindus, Sikh and Christian. We're talking about organ and tissue donation. Basically, they are allowed actually because we want to save people life. So again, remind you, this is one of the expert is that Dr. Asri mentioned that with our law from the Quran mentioned that there's never say no for organ and tissue donation and transplantation. So again, in newspaper, come out days is talking about pahala menyelamatkan satu nyawa sama seperti menyelamatkan seluruh umat Islam. So again, when we're talking about tissue and organ donation, there's supposed to be no harm and allowed for that. For Malaysia, we're talking about organ and tissue donations again. There's a law and legislations. We have come to what we call is opting in, informed consent. It means that whatever talking about organ and tissue donation, we need to get a consent for the closest family members, basically talking about the first degree of family member, they might get a consent before we go any procurement, donation, and transplantation. And opting out, or their terms for it is presumed consent that basically our organ and tissue in our body belongs to the government. And when it comes to patients for brain death or either brain death or cardiac death, the government can take that for donation. But again, even if we are seeing that not for donation, that's another issue comes in. So in Malaysia, what we're practicing is opting in, informed consent. It means that whatever procedure prior for donation or transplantation, we must get a consent from the family members. Okay, even though like myself, for example, I'm talking about organ and tissue donation, and even though I as a pledger, at the end of the day, when times comes to me, when I die for tissue and organ donation or transplantation from my body, it must be consent from my family members. So again, is it by talking about organ and tissue donation, by changing the law from opting in to opting out will increase the number of organ and tissue donations? There are controversies. So studies have been shown, survey have been done. It means that no matter what is it, when talking about organ and tissue donation, there are a lot of controversies when based on the opting in or opting out policy or law. So when talking about organ and tissue donation for myself, so when talking about organ donation, they must come from bottom of the heart. So what we need to do, we need to educate our people, keep educating and awareness to tell about the good about organ, tissue donation, to give life to other people. So another thing when we talk about organ and tissue donations, to increase the number or the organ and tissue donation rate, a lot of ways can be done. We're talking about organ trading. You are willing to do that by selling our organs from living donors where both the donor and recipient benefit, or we go for organ trafficking where exploitations of the people in order to receive their organ. These are really, we need to think of whether by doing this, is it okay? So organ prices. So people, maybe the audience, you come across thinking about, because the very little number of our organ donor basically we're just confined to Malaysia, people are thinking, is it okay we are selling our organs for that? So these are the things with the prices for each organ, how much it costs you. The very typical donor, most from them is under developing country. Yeah, people come across when talking about China, China is everything. So same goes when we have little number, when our donors in Malaysia is not that high, and then we can't get a tissue and organ for transplantation and organ donation, people are going abroad, going to overseas, go to China to get an organ there. So when we're looking about this, there's no organized system initially in China. In 1980s, then if you realize actually how did they get an organ, they go for executed prisoners. Are we willing to do that? Whether it's legal or illegal, looking at that point during the 1980s, they put it as illegal. And subsequently, the confidentially and agreements and with the law, they come up with the temporary rules concerning the utilizations organs from the executed prisoners. So we come subsequently when all the entire world, they work and have their one voice, they come with the new legislations. Just specifying hospital and any bring their certification must be done. So they ban the foreign transplant patient. But again, it still goes around when you're talking about this, China. So what happened in India actually? So because they have a lot of poor people there. When you're talking about India, they have very low costs for transplantation and donation, but with high availability. What I can tell you previously, India is the largest kidney transplant center in the world. So under the Transplantation of Human Organ Act in 1994 in India, they find out basically is unawareness among the people there. They promise basically by selling their organ, they promise high payment that actually they receive what they are promised, but unfortunately in real life, not much when they receive that. So the organ donor must be relative spouse or an individual donating for reasons for affection. So basically this come out in India, Indian Journal of Medical Ethics is issues organ farm. So basically with all these things comes in with the new Human Organ Tissue Act in India, there's no more in terms of organ trading in India. So what happened in Asia, basically, in Southeast Asia, we do realize that some of the countries practice transplant tourism where they are selling their organs. Looking at the photo here, they are not really a model, but they are showing their scar in the flank there because they are selling their organs to survive their life, to continue their life actually. Before 2008, when talking about organ donation, organ transplantation in Philippines, because they make it as illegal. Even they have the agency with all-in-one, inclusive with the prices there. But since 2008, basically they banned. So you realize that, as I told you, before 2008, the number of the transplant tourism is around 1,000. Subsequently, it's dropped to 50%. Okay. Maybe we come across last year what happened with our pandemic of COVID, but in middle of the year, the sounds of somewhere in August 2020 that we come out that Malaysian man remanded over organ trading, organ trafficking allegations. Looking at this guy basically, the one as a middle person in terms of organ donations and organ transplantations, organ selling, organ trafficking, basically by looking at the whole entire, basically is known to just to get the publicity. So if you are looking at this, all the number, when we're talking about organ trading, organ selling, organ trafficking, we come out in 2008 actually, Istanbul Summit or Istanbul Declarations. Malaysia is one. We are one of the participants when we're talking about organ and tissue donation and trafficking. The Istanbul Declaration, we to address the growing problems of organ sales, transplant tourism, and trafficking in organ donors. So the whole entire world, we come out with our declaration. We against organ sales, organ transplant tourism, and also transplant trafficking. So what we do. Before that, I just want to tell you a bit about the history of organ donation and transplantation in Malaysia. We started in 1971 and 75, where our first organ donation and transplantation, they come from basically this time is kidney was the organ that being transplanted and donated from the living related. The person is from Sabah, that Augustine Sidin, the brother that donated to Martin. And we have, in a year later, our first cadaveric brain death donor for kidney that happens in hospital Kuala Lumpur. And if you realize recently came out in the newspaper, in the social media about this, arwah Muhammad Afiq Ikmal, basically who are suffering from end-stage liver failure, that he received the donor from the non-related living donor, Muhammad Hafizam, he's the one actually donated part of his liver to arwah Muhammad Hafiq Iqbal. So in 1987, our bone marrow transplant started as a pioneer in UMMC, followed 8 years later when we had start first living transplant with that previous slide showed. And 1997 is our first heart transplant happens in IGN. So we have our National Transplant Resource Centre that started November 1997. Is opened by Tan Sri Dr. Abu Bakar Sulaiman. We organize in terms of transplant framework. So the strategies, looking at the number that I mentioned earlier from the beginning slide, and most of you know that our donation rate is very minute and very little, and we need to do something to overcome that. So under the Ministry of Health, the procurement team and the transplant team in the entire Malaysian population, we have to work together to improve our organ donation rate to give of life to the person. So we have to work together actually to achieve our dreams. We're talking about organ and tissue donations. So in 2019, basically, I have a meeting with Majlis Fatwa Kebangsaan to make it clear that organ donation can be part of the will, but they are looking into that to make it organ and tissue donation from patients, that can make it a will that we can be endorsed and can be implemented subsequently. So what we do, promotion every year. We're talking about Organ Donation Awareness Week. We do have it almost every year, October. We started in 2016 when we have this kind of Larian Dermo Organ. We're talking about our campaign and forum, Dermo Organ, a lot of things, activities in the social media when we're talking about organ and tissue donation. Subsequently, the activity, we do that in terms of, we have promotion showing that the good about what we need to do in terms of organ and tissue donation. We do some sort of audit the program GRUDA, the Grief Response Organ Donation Awareness among the medical personnel and non-medical personnel too. So we do have team basically how to go for promotion. We do that in terms of getting the pledges from the public. We do some sort of the donor runs to get the donors and all sorts of activities. So this is another activity when we approach the family member when the death comes into the hospital. Then probably when you assess the disease, then probably the disease can become actual from the potential donor become the actual donor. Some of the activities that we show to improve our skill, procurement, and transplantations. Just want to show you some figures, some numbers, some photos for our donors and recipients. If you're looking at this, okay, Lo Yun Moi basically is the end-stage renal failure. She received kidneys from the husband. So till now, she's no more go for any dialysis. So basically before she received she received kidney from her husband, then she has to undergo dialysis almost 3 times a week, and each time it's really contribute hours, time consuming and very costly. This lady, another one who received a kidney transplant. If looking at this guy, basically he received the heart transplant. Now he's very active, he's very productive, and can improve his quality of life. We're looking at this girl, when I mentioned you, it happens 25 years ago when she received the first Malay donor heart when she's suffering actually end-stage heart failure. Same. So if this is another one, we're talking about promotion, introducing people when looking about organ and tissue donation. These two guys is basically what I can tell you is our icon, or it can be both of them actually our spokesperson to the public when you're talking about organ and tissue donation. Both of them actually donated part of their livers to those who are suffering from end-stage organ failure. This is one of the activity that we held every year. What we call is Rancangan Bicara Hati. We call all the donors family to share in terms of how do they feel when they donated the organs from the loved one. So if you're looking for this, basically this guy, what I can tell you is a gift from the God actually. Three of his children become our actual donor. Means that every year, unfortunately, his sons have what I can tell you is MVS and end up with brain death, and he donated organs from all three of his children. So again, if you're looking at this lady, is our icon actually, Hong Ling. She writes books on I don't know you, but let me save you. This is a slogan that we need to tell to everybody, to the public, that no matter how what is our religious, what is our culture, at the end of the day, we can do something to save people's life. So same goes to here. When we're looking at the point, when we're showing that our organ and tissue donation program entire the world, when looking at this part, this basically the couple that the husband donated one of his kidney to the wife, looking at they can become continue their life together. Then we're looking about hidup sesudah mati. It means that when we're looking at the one who brain death or cardiac death donated their organ, they give life to other people to continue to improve their quality of life. So when looking at this photo, if people know that she actually the mantan or the ex the purple or the person who I can tell you the heroes organ and tissue donation in entire Malaysia, when she's the one basically promoting, talking about the important about organ and tissue donation in Malaysia. So comes you again showing that the number. So looking at the number of patients suffering from end-stage organ failure, waiting for their organ, the number day to day, even every seconds, every hour, the new number comes in. So, but against the number of donors is basically very little to overcome the demands there. We need to do something talking about promotion, talking about what do we mean by organ and tissue donation. We need to educate, we need to aware all the public in entire the world, including Malaysia itself, what is the benefit, what is the good when we're talking about organ and tissue donations. So, comes in the newspaper, our as health minister talking about, yes, our organ donor, even talking about the young people, still not many. So how to overcome that? In 2015, actually, we come up with a Jom Ikrar in Ministry of Health. Try to educate our own people, our Ministry of Health, what talking this program about, talking about organ and tissue donation, what is the important, what we can do to improve the quality of the life of those who are suffering from end-stage organ failure. So we educate our staff, non-clinical and clinical. We want to expose about organ and tissue donations to the public, to our own people, to the Ministry of Health, to our Prime Minister, what we're talking about organ and tissue donations. So from the previous government, in organ donation awareness week 2018, actually, Dr. Zulkifli Ahmad, the whole entire of the family put a will that they want to donate their whole entire family for organ and tissue donation when the times comes. This is what we need to do. We need to do something to improve our organ donation rate, to give life to other people. This happened 2018 when our previous government, when we have this organ and tissue donation. So yearly, when we're talking about organ and tissue donation again, we have the program of Bicara Hati. So the Bicara Hati, the program, basically we gathered along all the donors' family to share their experience, to share how they feel when we are talking about organ and tissue donations. At the end of my talk, I will show one of the program, I will show the video, what we have done. Basically, we to get the donor family to just give us some sort like educate awareness to tell the public the significant, the good about organ and tissue donation, basically to improve the quality of life. At the end of the day, a gift of life. So without the organ donors, there is no story, no hope, no transplant. But when there is an organ donor, life springs from death, sorrow turns to hope, and a terrible loss becomes a gift. Organ donations, a gift of life. Are we ready? Thank you. All right, I'm going to share you probably to look video.